Welcome back to the Pump YouTube channel. As part of our Everything You Need to Know Before Med School series, we are honored to help future medical professionals gain the knowledge they require when selecting programs and determining the best path for their medical career. In this video, we'll kick things off with the University of Toronto's MD program. UofT has continuously been named Canada's #1 university for graduate employability by a diverse range of recruiters from various industries, thanks to the university's overall capacity to educate students for evolving healthcare industry, while also still providing a globally recognized curriculum. The University of Toronto's MD program teaches students scientific methods for studying living matter, health, medicine, and illness. This education helps students comprehend and analyze the behaviors of humans and other organisms, while also still educating them to confront ethical, social, and political challenges associated with healthcare. The University of Toronto's MD program has two different campuses, St. George in downtown Toronto and Mississauga. Students are sent to one of these campuses after they are accepted into the MD program. Now that you have a better picture of the University of Toronto and its MD program, let's dive deeper into their admission stats. In the 2023-2024 admission cycle, 4,290 applicants applied for the UofT's MD program, and 640 were invited to interview. Overall, there were about 291 students who got accepted in the 2023-2024 cycle. Now, you may ask, what type of degree did these 2024 first-year MD students study before applying? Among the 2024 first-year MD students, about 17% of students have a postgraduate degree, 23% have a non-degree and a 3-year bachelor's, and approximately 60% of students have a 4-year bachelor's. Even though these percentages seem scarily low, this video will help you learn more about the UofT's MD program, and you might just be a part of that 7% of accepted applicants. At the University of Toronto, you cannot enroll in an MD program straight out of high school. You must have some prior experience at a university in Canada to pursue a degree. You can submit your application as early as the start of your 3rd year based on your educational background. There are various academic requirements such as a high GPA and MCAT score, as well as non-academic requirements such as essays, references, and Autobiographical Sketch, ABS. You must also take certain prerequisite courses. As for your GPA, the cutoff range for undergraduate applicants is a 3.6, and for graduate applicants it's a 3.3, regardless of whether you're from Canada or not. The average accepted GPA is a 3.95, but don't get unmotivated if yours is slightly under, as many applicants get admitted with a below average GPA. For your MCAT score, each area must have a threshold score of 125 with an allowance of 124 in one section. Your non-academic requirements, being your personal essays, references, and ABS, are used to assess your non-academic qualifications. The reason why they are important is that their goal is to choose students who they think will become the most skilled and responsive physicians. You must submit 2 brief personal essays of 250 words, each answering specific personal questions that change every admission cycle. The ABS is a list of your activities and achievements since the age of 16, which provides insight into who you are, and there are no requirements for any hours or activities. Finally, for your prerequisite courses, you must successfully complete 2 full course equivalents in any life science, and 1 full course equivalent in any of the social sciences, languages, and humanities. For those who don't know what a full course equivalent is, 1 FCE of a particular subject is equal to 2 semesters. Although these requirements seem like a lot, it's always possible to achieve them, so don't be discouraged. The last round of admissions process is the interview stage. UofT admissions will invite about 700 applicants for an interview for admission. You may ask, what is this interviewee selection process? Well, file reviews, which are reviews of your academic and non-academic admission requirements. They are used to choose your interview subjects. Interview dates are chosen at random once file reviews are finished. You will receive a letter of rejection if you are not chosen for an interview. As the files are being viewed, invitations to interviews and letters of rejection are sent out until the final interview date. The format of the UofT's interview process for the 2024-2025 cycle is the MPI format and takes place virtually. The MPI consists of 4 independent interviews assessed by 4 different interviewers, and each interview response is 5 minutes in length. Some tips and tricks to help you with your interview are to get familiar with the type of interview, whether it's a panel interview, MPI, or MMI. Once you are comfortable with the interview style, practice on your own by recording yourself and re-watching it over and over again to find mistakes. When you feel more confident after practicing on your own, try asking someone with experience, such as people who have already gotten into med school or a family member in the medical field, to help you practice the interview style one-on-one. Lastly, research some question banks with answers and go over those on your own, and again with someone who is experienced. Interviews can be stressful, but with these tips and tricks, you'll be feeling confident and ready. After discussing some of the academic criteria, let's take a brief look at the cost of tuition. Tuition costs vary depending on your application type, and fees are subject to change. The tuition fees for Ontario residents are $23,090 per year, $27,510 for non-Ontario residents, and $97,350 for international students. You may also expect to spend $1,000 for books and equipment, as well as around $17,500 for your living expenses, such as food, residence on campus, and other expenses. Now that the tuition costs are out of the way, let's break down the program for a better understanding. First, let's dive into the educational goals and competency framework. The goal of the MD program is to prepare graduates. The goals are to become medical experts, communicators, collaborators, leaders, health advocates, scholars, and professionals. Next up in the program breakdown is the foundation curriculum. In order to prepare students for the workplace learning that takes place during foundations, the first 2 years of the MD program, known as foundations, are held in laboratory, classroom, clinical, and community settings. Early clinical exposure is a key component, allowing students to apply theoretical knowledge in the real-world settings. Regular assessments provide feedback to support continuous improvement and self-directed learning. Every week of foundations, which lasts 72 weeks, includes specific goals and tests to direct students' study and help them to develop the essential skills and enabling skills for the MD program. The last 2 years of the MD program are devoted to clerkship. Clerkship is a comprehensive educational experience that helps you to advance the professional attitudes, abilities, and information you learn in foundations while learning how to effectively, efficiently, and humanely take care of your patients. This is accomplished through hands-on application in clinical settings. As a clerk, you gain expertise in patient care in hospitals, community clinics, and physician offices. UofT is affiliated with many reputable hospitals such as Mount Sinai, Sick Kids, and St. Michael's Hospital. Elective rotations allow students to explore subspecialties and align their experiences with career interests. Lastly is the grading system. Every course taken during the 4 years of the UofT's MD program is transcribed as credit or no credit, often known as pass or fail. Depending on the course's procedures, each assessment component may receive a numerical score that may or may not be communicated to the student. Hopefully you feel more prepared knowing how the program goes down. We hope that you now have a better understanding of how to apply to the MD program at UofT. The school has generated a large number of medical professionals and established a reputation as one of Canada's top MD schools because of its active population of learners and great research opportunities. Having said that, the PUMP team wishes you luck with the application process. Thank you for watching the video, and if it was helpful to you, please like, comment, and subscribe. We hope to see you in our future videos.